Good day, I am Edwin Jake Liganong. Today I am going to demonstrate infant care, which is cleaning, sterilizing, and preparing milk formulation. First thing you're going to do is to wash your hand and then disassemble the bottle, the cup, the crown and nipple or teeth, and the calibration button. Then separate the teeth and the crown and then put it to the basin with water. Also, we're going to use the big brush, small brush, leveling knife, and then the tongue. And then you have to put some water to the basin for the initial wash. Clean the equipments using the big brush or the small brush. Then pour down the water. Add another water. And then the soap. And then after that, you have to wash using the big brush and then the small brush to remove the milk curd. Now in cleaning the small parts, you have to use the small brush. Just ensure that there is no milk curd left to avoid contamination. To fully clean the teeth or the nipple, you have to squirt it with water and soap to clean the inside. And then pour down the water and add some another water for rinsing. Pour down the water and then add another water for washing rinse. Pour down the water. After that, you have to put the equipment to the pan for boiling or sterilizing and let it boil for 25 minutes. Then the counting of minutes will be the boiling point, then count for 20 minutes or 25 minutes and arrange the equipment to the pan, but don't put the nipple yet. Assuming that I plug the pan for boiling, so from boiling point you have to count for 20 minutes, so assuming that it is 25 minutes later, then after that you have to put the nipple for 5 minutes. Now a little bit reminder in opening the can, so you have to open the can by avoiding the steam like that or like this, like that. Now you have to set aside the equipment that is no longer needed. And assuming that it is 5 minutes later, so we have to get the equipment one by one. First, you have to get the tongue, and be careful because it's hot, then the bottle, and then the other materials. Now we're going to assemble the calibration or calibrated bottle. Now we have to set aside the equipment that is no longer needed. After that, we are going to prepare the milk formulation. Remember that we have to follow the doctor's orders. Now first we're going to put 2 ounces of water, because the formulation it said that this is 2 to 1, which means 2 ounces of water and 1 scoop of powdered milk. Now we have to scoop the milk using a scoop. And label it using the label knife. And put it into the bottle. Now in shaking the bottle, we have a process like this, and a cellular movement like this to avoid the bubbles in the milk, to avoid kabag to the baby also. And now we're going to set aside the milk, because we're going to feed the baby after the bathing. So we have to clean the area and set aside the equipment that is no longer needed. Now we're done preparing milk, so let's proceed to another step. Good day, I am Edwin Jake Biganong. Today I'm going to demonstrate infant care, which is the infant bath, feeding, and birthing. So first we're going to do is we have to gather the equipments, and don't forget to hand wash or hand hygiene before doing any procedure. So assuming that I'm done with the hand washing, so I'm gonna use thermometer for the taking the temperature of the baby using the tympanic area. So the baby temperature is normal. And then you have to prepare a Macintosh or a continent pad to avoid missing around. And then also put a towel under the baby tub for bathing to avoid sliding. And then you have to put some water to the tub, 1/4 to 1/2, and then test the temperature using your wrist. Now we're going to prepare some cotton balls using forceps, a sterile forceps, with a little bit of water to the kidney basin and some alcohol for cleaning. Now when you get the baby, you must support his head or neck carefully, and then put the baby to the Macintosh. Now we're going to clean the baby's face using a cotton ball which is slightly moist. First we're going to clean is the inner and outer canthus, from inner to outer canthus. So inner to outer canthus, and then inner to outer canthus. Dispose. Next is the baby's face using the ease stroke from forehead to nose, and nose to chin, and chin to ear and the neck. and then from forehead to the cheek, from nose to cheek, then chin, under his nose, in the ear to the neck, and then the other ear, and the pinna. Then make sure to clean the face nicely and don't forget the neck area. Next we're going to do is the cleaning of the baby's head. Now we have some water and basin, so you have to hold the baby football hold, then supporting his head and neck, and then you have to hold the baby like this, and then clip his ear to avoid the entering of the water to his ear. Then wash the baby's head. Then use some soap and massage the baby's head using your finger, not the nails. Now we're going to pat dry the baby's head carefully. And then cover the baby's head and get some new cuff for the baby to avoid chilling. Cover the baby's head. Now let's prepare some cotton balls using the forceps for the other cleaning. And then put some alcohol and some water to the kitty basin. And now we're going to remove the diaper, and you have to clean the baby's groin and perineal part using the clean area of the diaper. And then after that you have to roll the diaper down and remove the diaper or dispose the diaper. Using the slightly wet cotton balls, we have to clean the perineal part and groins of the baby, and also the back butt of the baby. And now we are preparing for the bathing of the baby. You have to put some towel to your chest to avoid wetting yourself or messing around, and to cover the baby to avoid chilling. And now carefully get the baby to support his neck and head, and then go to the tub and start the bathing of the baby. And wash the baby from the chest to tummy and shoulders. Don't forget the neck, and then to the lower part or lower extremities of the baby. And then use some soap from chest to tummy to shoulders. Don't forget the neck, and then to the lower extremities. And after that, wash the baby with water. Turn the baby to the other side to wash the baby's back. And do the same procedure from up to bottom. And then cover the baby with a towel to avoid chilling. And then set aside the old flanela or the hooded towel and prepare a new one. Arrange the baby's shirt to the flanela. As well as the diaper. Again, always cover the baby to avoid chilling. And then prepare the baby's pajama. Now we're going to clean the baby's nose and ear using cotton buds or pleats. Remember that when you are cleaning the baby's nose and ear, you must be gentle and careful. We are using a cotton buds that is slightly moist. But in cleaning the baby's ear, it must be a dry cotton buds. Now we have to put some alcohol into the kidney basin with the water on it. Now we're going to use some cotton ball for cleaning in the umbilical area of the baby. In cleaning the umbilical area of the baby, it has to be from inner to outer with a circular motion. Do this procedure at least 3 times and then dispose the cotton. Now we're going to put some baby's gloves. Remember that in putting baby's gloves, it must be the wrong side to avoid wounding the baby or cutting the baby's finger. And arrange the materials needed to be followed. But first we must put on the baby's shirt. Remember that you have to always cover the baby to avoid chilling. Now remember, don't tie so tightly the baby's shirt to avoid suffocating or harming the baby. And now we're going to put the diaper to the baby, but first you must taste the baby's diaper to avoid some leakage. Now if your baby is a male, the front part of the diaper should be higher, but if your baby is a female, the back part of the diaper should be higher. This is also to avoid leakage. And then put the bib to the baby's neck, but again don't tie it so tightly. Now set aside the materials that is no longer needed. And now put some birthing towel to your chest because we're going to feed the baby. Get the baby and handle with care. Protect his head and neck. Now you have to pick the bottle like this, and first you have to remove the cap like this, and then use the rotting reflex for baby's feeding. Now the baby is full, we are going to proceed to the barfing. Face the baby towards you and put his abdomen to your chest or upper chest and massage his back. And also observe the baby. Now the other way of birthing the baby is you have to put the birthing towel to your arm or crook and then turn the baby towards you and then put the baby's abdomen to your crook and massage his back. And then also don't forget to observe the baby. Lastly is the birthing using your lap. Put the birthing towel to your lap and then put the baby's abdomen to your lap and massage his back. And also don't ever forget in observing the baby for his or her own risk. And now we're done birthing the baby, then wipe the baby's lips or mouth using the bib. Now before returning the baby to his crib, make sure that you check his crib, that there is no sharp object or any object that can harm the baby. And then you have to lock the wheels of the crib and then put the baby. And then you have to raise up the sidings of the crib for safety purposes. And after that, you have to clean the area and document what you have done. That's all. Thank you.